I'm keen to hear from you on this one, 131873. Have you delayed taking your pet to a vet, whether it's for a regular checkup, whether it's for various immunisations for your vet, or whether when your pet, your dog or your cat is clearly sick, you haven't taken your animal to a vet? Is that because you can't afford to? Some research has been released today by Petstock, and they've found a third of Australian pet owners, 36%, are turning to home remedies, or they're looking up online. They're doing a Dr. Google for their pets instead of going to a vet. And then 34%, when they have taken their dog or their cat or their other pets to a vet, they've asked for a cheaper option, maybe something not as invasive. Dr. Sam Kovac is from Southern Cross Veterinary Clinic and joins us. Hi, Doctor.
Great to be with you, Clinton.
In your experience of recent times, are you coming across pet owners who avoid coming to see you?
Yeah, and it's sometimes a very embarrassing point for the family to admit, saying, I know I should have brought Fluffy in a week earlier. We were prioritising our family's other financial matters. And I get it. It is really tough out there for everyone, vets included. But, yeah, we're definitely seeing changes in pets coming to the clinic. We're seeing more sort of severe cases. So a dog that 3 days ago wouldn't have been as sick. So we're seeing an increase in those sorts of cases, and then we're also seeing a decrease in the routine care appointments like vaccinations and the annual checkups, the dental checks.
Is it the same with a pet, with a dog or a cat or other pets, as it is with humans, that if you avoid those regular checks, it may well lead to greater costs down the track?
For sure. So I think that old adage, cheap is expensive, really does ring true when it comes to medicine as well. Just something simple like even dental health, right? So we're seeing so many more of our dental cases now requiring multiple extractions, where we know if that client would have come 6 months ago or even a year ago, we could have gotten away with a scale and polish, and it would have been a quarter of the price for the family. And that dog's also then been suffering in pain without going to the vet.
The research that's come out today shows that some pet owners are doing the old Dr. Google thing, as we do sometimes with our own health. Why is that bad?
Well, I don't think it's entirely bad, to be honest, Clinton. In fact, I think any vet listening to this program would agree that they often do a Dr. Google themselves in the consult room. If you've got some weird symptoms and you just want to run a few ideas, and especially with generative AI now, right? A lot of people are coming in and they've already thought about the treatment plan. So I don't think Googling is terrible. What I do think is bad, though, is following then the treatment recommendations. Like, we all know AI can have hallucinations in our own searching.
Yeah.
For example, the story of a dog with kennel cough. The owner goes to Chemist Warehouse or whatever chemist, buys the wrong type of cough syrup. The dog can get really sick.
Tell me about costs, though. My wife, and I'm saying this as somebody who is married to a vet nurse, so she does work for a vet in the southern suburbs of Sydney. A lot of people will tell me it's just too damn expensive to take our pet to a vet. How do you justify the big costs?
Yeah, and it is. Vet care over the past... I've been a vet for 15 years now. I started the clinic 14 years ago, and I've just seen how with, I guess, closing the gap between human and veterinary medicine, it's such a narrow gap now. Like, veterinary medicine is so advanced. With that comes huge costs, and we don't get the Medicare rebate that doctors and hospitals do. And a lot of people think, and I hear it from my friends too, how lucky you are. You must be so rich as a vet. I can tell you the profit margins are, and your wife will tell if she's involved in management, the profit margins are slim. In fact, my cat hotel in Surry Hills makes a better profit margin than all three of my clinics put together.
Because you don't have the expense of the medical equipment and the treatments. The treatments, though, are quite remarkable, particularly the diagnostic tools you can use now. Particularly, I know in the area of cancer, for instance, what you're able to do there is quite amazing.
It is. Apart from just the scans and everything, there's always new stuff coming out, Clinton. Like, it's a great time to be a vet, to be able to help out these animals, and it's inspiring. But, for example, I was on the program, I think about a year and a half ago, and we were talking about one of my corgis, Clara, my favourite corgi. She passed away from a type of cancer called lymphoma. I didn't pick it up. She was only sick for 3 weeks until she passed away. And, I mean, I was her vet, her personal live-in vet. She slept in my bed every night. I couldn't pick up the warning signs. But, for example, there's this new test that's come out of the US. I was there at a conference in February this year, and it's now approved to be used in Australia. We're using it in the clinic every week. It's a blood test that can pick up specifically lymphoma. So if I would have had that for Clara, I would have tested her every year, because dogs age at roughly 7 times the rate of people. So I would have just added that onto a routine annual test.
But obviously there's a cost with all this. Appreciate your time today, Sam. Thank you.
All right, thanks for having me, Clinton.
Dr. Sam Kovac, who's from the Southern Cross Veterinary Clinic. Have you been in that situation where you know your pet, dog, cat, whatever, you know they're not well, you have a look at how much cash you've got that week and you simply can't afford to go to the vet? It is damn expensive. Let me know.